The prostate plays a crucial role in male sexuality, and its health can impact various aspects of sexual function. Here are some ways in which the prostate can affect sexuality. Ejaculation. The prostate gland produces a significant portion of the fluid in semen. Problems with the prostate, such as inflammation or enlargement, can affect the volume and consistency of ejaculate. Conditions like prostatitis, inflammation of the prostate, may cause pain and discomfort during ejaculation, impacting sexual pleasure. Erectile dysfunction. The prostate is located near the base of the penis and surrounds the urethra. Enlargement of the prostate, a condition known as benign prostatic hyperplasia (BPH), can exert pressure on the urethra, potentially leading to difficulties in achieving or maintaining an erection. Libido and testosterone. The prostate is involved in the production of some substances that influence testosterone levels, a key hormone for male sexual function. Changes in prostate health may indirectly affect libido and sexual desire. Prostate cancer and treatments. Prostate cancer, if left untreated, can spread and impact sexual function. Additionally, treatments such as surgery, radiation, or hormone therapy may have side effects, including erectile dysfunction or changes in libido. Orgasmic function. Conditions affecting the prostate, such as prostatitis or an enlarged prostate, can sometimes cause discomfort or pain during orgasm. This can lead to a decline in sexual satisfaction and may affect overall sexual well-being. Your prostate, the undercover agent, plays a role in testosterone matters. Changes in the prostate script might whisper to your libido, nudging it in different directions. So, keeping tabs on your prostate health is like having a secret weapon for maintaining that game desire. It's important to note that not all men will experience these issues, and many can maintain a healthy and satisfying sex life throughout their lives. Regular checkups with a healthcare professional and prompt attention to any symptoms or changes in sexual function can help address potential prostate-related concerns. Additionally, maintaining a healthy lifestyle, including regular exercise and a balanced diet, can contribute to overall prostate health and sexual well-being.